Imagine your body is performing its most incredible repair work after surgery, carefully mending tissues and bringing you closer to full recovery. A critical part of supporting this healing journey and avoiding any setbacks lies in something seemingly simple: protecting your surgical dressing. So, how do you keep your surgical dressing clean and dry, ensuring your recovery stays on track? Keeping your surgical dressing clean and dry is absolutely essential for preventing infection and promoting optimal wound healing. This crucial step creates a protective barrier, shielding the delicate surgical site from harmful bacteria and environmental contaminants. It directly supports your body's natural ability to close and repair the incision effectively and efficiently. The primary reason this is so important is that moisture creates an ideal environment for bacteria to grow and thrive. When a dressing becomes wet or soiled, it loses its ability to protect the wound, turning instead into a potential source of contamination. A clean, dry dressing helps maintain a sterile or near-sterile condition, which is vital for the various stages of tissue repair and regeneration. This protective barrier also reduces the risk of skin irritation around the incision, which can sometimes occur from prolonged dampness. To practically keep your dressing clean and dry, start by strictly following any specific instructions from your healthcare team regarding dressing changes and wound care. Generally, avoid direct water exposure to the dressing, especially during showers. You can use waterproof covers, often available at pharmacies, or simply use plastic wrap sealed with medical tape around the edges to create a temporary barrier when bathing. Be gentle when moving around, as any friction or pulling on the dressing can loosen it or compromise its integrity. Always wash your hands thoroughly with soap and water before and after touching the dressing or the area around your wound, as good hand hygiene is your first line of defense against germs. If the dressing becomes visibly dirty, wet, or dislodged, change it promptly using clean hands and sterile supplies as you were instructed. An important tip for success is to prepare your showering area beforehand by having all your waterproof covers or plastic wrap ready. Consider a stool in the shower to minimize movement and reduce the risk of accidentally dislodging the dressing. You might also find it helpful to gently pat the area around the dressing completely dry with a clean towel after your shower, being careful not to touch the dressing itself. Remember that certain advanced dressings are designed to be water-resistant or even allow for showering, but always confirm this with your medical team. Your healthcare provider can also guide you on recognizing early signs that a dressing might need changing, such as increasing warmth or discharge, even if it looks dry from the outside. By diligently keeping your surgical dressing clean and dry, you are actively participating in your own recovery process. This simple yet critical practice significantly lowers your risk of complications like infection, helps to ensure your wound heals smoothly and quickly, and ultimately supports a more comfortable and predictable journey back to full health. It is a fundamental way to safeguard your healing progress and prevent unnecessary worry.